Okay, today I'm going to talk about bedside shift report and how it increases patient safety. Research shows that 80% of serious medical errors involve miscommunication during handoff report. I think we can all agree that we have a large patient-to-nurse ratio, and often keeping patient information in order is difficult. The inaccurate information exchange can lead to poor patient outcomes. Preventable patient falls have been identified through this lack of bedside report. Hospitals have protocols in place to prevent falls, such as bed and chair alarms, gait belts, non-skid socks, and armbands. But they are not beneficial if they're not implemented. Lack of bedside report has also resulted in unnoticed medical errors and inaccurate reports. Most report is done outside the room without patient involvement. This is sometimes easier, but is often not what is safer or in the best interest of the patient. Report at the bedside of the patient is one way to improve patient safe and accurate handoff. I researched 5 different studies that involve bedside report and its effects on patient care. Many of them have similar beneficial results. The first study was performed at a UK trust. The purpose was to research the impact that shift report had on both patient and staff. They discovered that report was given in many different areas of the unit. There was not a consistency, which I believe we can relate to here. Patients were found to enjoy getting information at the bedside about their health. Nurses also stated seeing more patient involvement. The second study was done by a medical surgical utilization team at West Virginia University. 7 medical surgical units were involved. Patient and nurse satisfaction, patient falls, and medical errors were the focus. Surveys were given to patients after 48 hours of hospitalization. Surveys included 7 different areas of care to be rated. Patients reporting better nurse-to-nurse communication, patient falls, and medication errors were also decreased. The University of Michigan Hospital developed a plan to relocate report to the bedside as well. The goal was to strengthen patient care, reduce call-out use, increase direct time with the patients, and promote staff retention. Nurses were satisfied with the change. They were able to have more accurate handoff without distractions and have opportunity to ask questions. Another study took 60 patients and surveyed half getting bedside report and half not. This study shared that many patients felt safer when observing bedside report. Again, questions were able to be asked and oncoming staff were able to visualize their patients. The final study that I researched was done by Colleen Ferris. She conducted a study on her own medical surgical unit at Tacoma General Hospital in Washington. She stated that she heard many benefits after implementing bedside report. Rapid responses were caught sooner because patients were being observed faster. Prompt dressing changes and IV bag replacements were also caught. So for my PICO question, I chose, does patient bedside shift report lead to increased patient safety? So the literature reviews supported this, that patient care is directly affected by relocating shift report to the bedside. If I were to conduct a study, I would target the entire population of the medical surgical unit. The main intervention would be to provide bedside shift report. The main intervention would be providing bedside shift during bedside report during shift change, which for us would be 7 p.m. and 7 a.m. I would compare between patients who do receive bedside report with those who do not. My desired outcome would be to decrease falls, medication errors, IV problems, and to increase satisfaction. The theoretical framework I would use is the theory of goal attainment. King, the author of the theory, states that a person has 3 fundamental needs. These include the need for health information, the need for care to prevent illness, and the need for care when he or she is unable to provide for himself or herself. This theory would involve nurse-to-patient communication. This is applicable to bedside report because the goal is to improve communication between staff and patients and discuss safety requirements. So the research I would conduct would be a quantitative study. It will include fall rates, incidence of medical errors, IV infiltrate rates, overall patient satisfaction. There will be a control group and an experimental group. Surveys will be used to gather information. At least 300 patients will need to be involved for the accuracy of this research. The group will be split in half to make up the control group and the experimental groups. The time frame for the study will be about 4 months. All patients will meet the criteria for safety needs. Each room will need to be set up so that safety protocols can be carried out. Patients will need to be able to understand, process the information that's given to them. They will need to be able to read, write, and understand English. Written consents will be available for patients. This ensures that their rights are protected as well as confidentiality. This will need to be signed. If visitors are present, the patient will be asked if they are comfortable with their health information being shared. If not, the staff will ask visitors to step out of the room during the report. Surveys will be used for data collection and analysis. A survey similar to the one used by Carrie Sanjeklin and Jay Sherman will be used in this study as well. The survey used will address 17 items that deal with nurse behaviors. Each question will have a 5-point Likert type response option, like strongly agree, disagree, neutral, agree, or strongly agree. A linear regression will be used to plot medication errors and patient falls during the study. Formulas will be used to ensure accuracy of the study. SPSS is a program that will be used to enter the data gathered and create tables and graphs of results. Analysis of variance, or ANOVA, will be used to compare the responses. The linear regression will give a visual of the data collected. The ultimate goal for our patients is treatment and safety. Many patients we receive are at risk for many safety problems. It's important that steps are taken to prevent harm to the patient. Bedside shift report seems like something that is so simple, but as you can see from my presentation, it can make a big difference in the outcomes of our patients. And that is my references. Thanks, team.